Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're talking about something that so many midlife women worry about. Memory slips, the names that used to be instant and now aren't, that mental fog, forgetfulness, walk into the room, why am I in this room? And of course, the big fear that's underneath it all, dementia. Here's the empowering truth that I'm really excited to talk about is most cognitive decline is influenced by factors that we can control, right? Modifiable factors. And many changes begin 10 to 20 years before the symptoms show up. What this means in real time is that midlife is not too late. It is the perfect time to get ahead of it. But it's really important that we do because once symptoms show up, it's a different ball game. So all of these things are happening 10 to 20 years. These changes are happening 10 to 20 years before the symptoms show up, so we can start addressing that now in midlife. Now, we talked about longevity last time, and I do want to kind of briefly revisit, and I don't even remember how much I emphasized it, but as we break down cognitive health and preventing cognitive decline, preventing dementia today, I want to say that the emphasis, exercise is one of the number one things you can do for longevity. And I'm not really going to talk about that today. Today, I want to dive into what labs to run. We're going to go a little bit deeper in nutrition. We're going to break down supplements, what works, what's more hype. But I want to emphasize again that exercise and muscle are key. And this doesn't cost you money, except maybe, some equipment or gym membership. It is effective. It's safe if done right. And so exercise is really important, even though I don't talk about that today, both for longevity and for our brain health specifically. All right. And muscle is super important. So let's first break down brain fog versus cognitive decline versus dementia. What is normal? What isn't? So brain fog is when you feel slower. You feel like your thinking is slower. Maybe you're more distracted. You're having trouble finding words. This is super common in menopause, when we haven't slept, when we're very stressed, when we're inflamed, when we're having blood sugar swings. Our blood sugar is going up and down. This is completely reversible when the underlying cause is addressed. And when you're in a brain fog state, like your cognitive testing will be normal. So women often mistake brain fog for early dementia, especially during menopause. And that this causes unnecessary panic. So be aware of that piece. The brain fog is not what we're going to talk about next, which is mild cognitive impairment. So mild cognitive impairment, MCI, is a measurable decline on these brain health tests, on your cognitive functioning. So people can still function when it's mild, when it's MCI, people can still function independently, right? But you're compensating. You're functioning because you're compensating. And this is the window where lifestyle makes the biggest difference. This is also the window where family history, genetics, and risk factors matter. And then dementia are when cognitive changes interfere with daily functioning. Finances, driving, managing medications. This is not where you want to start interventions. This is not where we want to start interventions. Earlier is better. So if you have a strong family history, earlier is that much more important. But for all of us, starting earlier sets us up for success later in life. So I do want to talk about the foundational labs that we all should check. And I want to kind of simplify it. I'm not going to go super deep, but I do want you to be aware of the things that you can run. So B12 and homocysteine. This is a big one because low normal B12 can affect your memory. So what we're finding is levels below about 400 are associated with higher dementia risk. And homocysteine is also a major clue. When it gets above 15 to 16, you have an increased dementia risk. And so there's a kind of a cutoff where we see an even greater risk at like 17 and above. So in that range, when we start getting above 15 to 16, the risk starts increasing. You want homocysteine low, and you want B12 in the mid to upper range. Now, let me also say that serum B12 is not always accurate. So depending on if the labs match the symptom picture or not, sometimes other labs you might want to run, like methylmalonic acid or MMA. Sometimes I'll run that on women when the picture doesn't match the labs. Now, we are going to go a little bit today into the genetics of if you're an ApoE4 carrier. Because if you're an ApoE4 carrier, you have a greater risk of dementia, and ApoE4 carriers seem to be more sensitive to low B12. So that's where knowing some of these pieces, we can sort of start to differentiate what the levels of importance are. So takeaway, B12 is pretty inexpensive, it's safe, and correcting even a mild deficiency can help cognition. Number 2, thyroid function. I think thyroid function comes up in like every discussion we have, right? Fatigue, hair loss, brain fog, etc. Hypothyroid can mimic cognitive decline because of those things I just listed. It equals fatigue, it equals brain fog, it equals slower processing. There's an easy fix. So let's figure out if your thyroid is functioning. We also want to look at your complete blood count, CBC, and iron status. Both anemia and iron overload can affect cognition. Vitamin D comes up in a lot of our discussions as well, and low levels are associated with a higher dementia risk. But what was interesting in a lot of the research is the research didn't show that supplements fixed it. So I think the takeaway for that is like optimize your vitamin D, but this is not about megadosing. You can't really megadose your vitamin D into dementia prevention necessarily. But if your vitamin D is low, you do have like a 40 to 50% higher risk of dementia. That was in observational research. So again, just know your levels and optimize, but let's not go crazy mega dosing and get your sunshine, and because mostly the supplement trials haven't shown benefit. It's more, I think it's more of an overall marker of your health. Your vitamin D status is kind of an overall marker of your health. Also important, kidney function, your lipids, inflammation, because vascular health is brain health. And then this one's a big one. I feel like this comes up in a lot of our discussions, blood sugar and insulin resistance. One of the strongest predictors of cognitive aging is insulin resistance. And after menopause, and we're going to break down menopause here shortly, after menopause, we are more likely to be insulin resistant. Our insulin sensitivity goes down. And insulin resistance is directly linked to Alzheimer's risk. This one matters more than people realize. Glucose and insulin pathways are deeply tied to your brain health. And this is why a lot of researchers and people today are referring to Alzheimer's as type 3 diabetes. And this is also why midlife, especially menopause, is a crucial window. So let's talk about ApoE4. Should you test it? ApoE4 is the strongest genetic risk factor for Alzheimer's. Should everyone test it? No. Do some women benefit from knowing? Yes. So it's really not for everyone, okay? This can create unnecessary stress potentially, but I consider testing when there's a strong family history, when there's high anxiety around dementia, the woman wants personalized dementia prevention strategies, and maybe a menopause transition where the timing of hormone therapy matters. because we're going to get into that a little bit, so that can be a useful time. And maybe just you're designing with your practitioner, or like, this is how I would work with my patients, a long-term prevention plan. So ApoE4 matters because carriers respond differently, or in some cases are more sensitive to the supplements, the dietary changes, etc. So ApoE4 carriers respond differently to saturated fat, meaning they're more sensitive maybe to saturated fat in the diet. They're more sensitive to late initiated hormone therapy. Doesn't mean they can't, but could mean that maybe the risks outweigh the benefits. Again, everything is individualized. Poor sleep, insulin resistance. So the interventions are the same, but the urgency is different. So remember, knowledge is power. It's not destiny. When I say that, like, it could create undue anxiety, let it be power. Doesn't mean it's your destiny. It just gives you more information, and maybe you have to take more urgency with some of these interventions. All right, let's talk about menopause and cognitive changes, because here's the deal. Many women experience temporary cognitive changes during the menopause transition. Word retrieval, slower recall, fuzziness. And this is heavily influenced by sleep, by mood, by vasomotor symptoms, metabolic shifts, not just estrogen, but you can see where a lot of these things are affected by our changing estrogen, which is why hormone therapy initiated earlier can really be a game changer. But the other big thing I want to point out is that what we found in the research is abrupt estrogen loss, like surgical menopause, for example, a complete hysterectomy where you're just pushed right into menopause abruptly. There's a significantly higher dementia risk. And early hormone therapy can prevent that. Okay, for natural menopause, starting MHT early, near your transition, near your menopause transition, maybe even in perimenopause, is neutral to possibly helpful for long-term cognitive health. Again, we're going to hear different things out there on this. The research is still a little bit unclear. I mean, the thing with progesterone, estrogen, testosterone therapy is the earlier the better. We do know this. And these hormones affect the oxidative stress in your body. They affect, breaking, like catabolism versus building your muscles back up. They're going to help you build rather than that muscle breakdown that happens naturally. They affect your metabolism. They affect your sleep, those vasomotor symptoms, and our lean body mass, our muscles, our bone support. So all of these things, especially when initiated early, can absolutely have a positive impact on your risk of dementia. But it's the research on cognition has been unclear. And especially when we're looking at starting it after 60. Again, we talk about the window of opportunity, under 60, within 10 years of menopause. That's just a general guide. It's just a general guide. And, Callie Casperson likes to say, like, it's not like, on day one of your 60th birthday, like suddenly your body's dramatically different, right? So does that mean you can't start it after 60? Does that mean you can't start it after that quote unquote window? No, it does not. But it's really important to work with someone who's educated and be individualized to you. So when we look at starting after 60, especially in ApoE4 carriers, it is potentially harmful. It's potentially harmful. We don't know. We don't know, but it may increase your risk. And this is where it's individualized. What are your individualized risk factors? Where is your comfort level? What are your symptoms? And so just be aware that, let's say if we're looking at initiating hormone therapy after 60, because lots of women start hormone therapy in their 60s, their 70s, then it could be worth testing the ApoE4 carrier status. So let me also say that this doesn't mean every woman needs hormone therapy for their brain health. My point in this conversation is that timing matters and that midlife is the best window to intervene for that brain metabolism connection. So timing matters. I know that some people are even getting away. We went from calling it HRT to MHT. So it was hormone replacement therapy. Then it was menopausal hormone therapy. Now some people are calling it PET therapy, like progesterone, estrogen, testosterone, PET. So I call it PET therapy, but that sounds weird. What am I trying to say? Because it can be started in perimenopause and can be incredibly beneficial because so many of the changes, the bone loss, et cetera, is happening before we're menopausal. So we are changing and playing around with the terminology just so that you're aware if you hear these different terms. Okay, so let's get into the big drivers of cognitive health. Talked about exercise already, talked about muscle already, sleep. Sleep is huge. Sleep apnea, short sleep, very long sleep, restless legs. These are all associated with cognitive decline. So, do you have sleep apnea? Have you been tested for sleep apnea? Do you have chronic sleep restriction? These both dramatically increase your dementia risk. So, if somebody is concerned or talking a lot about memory issues, sleep testing is often step one. Okay, women are very grossly underdiagnosed with sleep apnea, and so this is something really worth looking into and finding out, because women with brain fog or memory concerns should always ask themselves, what is my sleep actually like? Because if you're snoring, if you're having a lot of daytime fatigue, you're waking unrefreshed, do a sleep study. Do a sleep study, because that's a potentially easy fix. I know that the CPAP and it's not great, but they found that even wearing them for 4 hours during the night can make a huge difference, because sleep is when your brain detoxes. Sleep is important for recovery. Sleep is important for your hormones, and it's your brain detox period. Okay, blood sugar and insulin resistance. As I said earlier, this is huge. This is basically Alzheimer's as type 3 diabetes. So stabilizing blood sugar in your 40s and 50s is one of the most brain protective things you can do. So the sugar cravings, they matter. They can come into balance. They can get worse when our hormones go out of whack, for sure. So women, you should know your fasting glucose, your fasting insulin, which a lot of doctors aren't running, your hemoglobin A1C, your HOMA-IR score, which is your insulin resistance, your triglyceride HDL ratio. Optimizing metabolic health is brain protection, which again, plugging the exercise, plugging the muscles, plugging the strength training. Muscle burns more fat, muscle increases your metabolism, optimizing your metabolic health as well. So that is brain protection, and more muscle is going to decrease your insulin resistance. So we could probably weave exercise and muscle and protein into all of these topics. Protein is going to help your blood sugar and your insulin resistance. Muscle will help, exercise will help. I mentioned vascular health earlier. Hypertension, cholesterol, inflammation, these all affect your brain decades before symptoms. So stop ignoring your body's check engine lights. These all affect your brain decades before symptoms. Mood, anxiety, depression, these can mimic or amplify cognitive symptoms. So address these things. This is your body communicating with you. Okay, let's dive into nutrition, because it is right there with exercise as your number one modifiable factor. What you eat today is shaping your brain 20 years from now. 20 years from now. So the most validated framework for nutrition is the mind diet. The mind diet for your brain. It's a hybrid of Mediterranean and DASH. So let's just break it down. And look, you don't have to incorporate all of these things. Grab one or two. This is just information. I want to give you actionable things. Olive oil as your main cooking fat. Leafy greens most days of the week. Berries 1 to 2 times a week. Nuts, seeds, legumes. Whole grains for stable glucose. I know we all want to go low carb, but we need our carbohydrates, and whole grains have been shown to stabilize your blood sugar. Fish weekly. If you eat fish, your DHA matters. Poultry, if you eat chicken, is included in this. And then like herbs, spices, colorful plants. What is not beneficial and what is harmful? High saturated fat. So again, These keto diets, the carnivore diet, high saturated fat is not good for your brain. In fact, they found in studies replacing just 9 grams a day of saturated fat with olive oil or nuts, 30 to 50% lower dementia risk. It's huge. 30 to 50% lower dementia risk. And ApoE4 carriers are especially sensitive to saturated fat, as I mentioned earlier. So what does this mean? We're avoiding buttery pastries, fast food, processed meats, cheese in excess, drinking. Sorry, I kind of connected those two, but not all of those went together. Lower your saturated fat. And then also what hurts, I kind of lumped it together. Also what hurts are buttery pastries, fast food, processed foods, alcohol, cheese in excess, etc. But looking at because all of these things are part of the mind diet, what I just listed as beneficial, what I listed as harmful. Just a 3-point increase in your mind score. Like you can do a mind diet scoring where you're looking at how many of these things you're actually incorporating. Just a 3-point increase in your mind score equals a 17% lower dementia risk. So you can find these online and you can look at what I just listed and you can add up your score. And then, like I said, you don't have to incorporate all these things, but maybe 1 or 2 changes results in a 3-point increase. You've now lowered your dementia risk by 17%. So this is realistic, right? I'm trying to make this realistic. These are easy swaps. Instead of butter, olive oil. Instead of cheese, nuts. Instead of cream, avocado. Okay, also important omega-3s. I'm lumping this in the food piece before we get into supplements because we have found that food sources are better than supplements. So fish, again, if you eat fish, try to get clean fish. I like, sustainably, like not trashing dolphins and whatnot personally. Well, I don't eat fish, but that's what I would encourage. Fish 1 to 2 times a week. DHA is particularly important, and ApoE4 carriers may need higher dosing if you're doing a supplement or more dietary fish. There's an absorbability difference. Again, that's where knowing the carrier status can be helpful. Just doing these changes earlier is better, and then combine these changes with a good B12 status. So if you're vegan or vegetarian, you're going to want to supplement with B12. Some other key players, just to mention, choline greater than 350 milligrams a day can cut your Alzheimer risk by 51%. So this is egg yolks, soy, beans, tofu, quinoa. B12, especially if your homocysteine is high. Folate-rich foods, greens and legumes. Alcohol, there is really, truly no safe level for your brain health. I know it's bad news for all the wine drinkers out there, but there's really no truly safe level for your brain health. And then tea and coffee. Let me touch on this briefly because this is fascinating because I know we've been demonizing coffee for a number of years now. Coffee is a really high source of polyphenols. So coffee is associated with a decreased risk of cognitive decline. So they found with coffee that up to 2.5 cups a day was where the peak benefit was. So up to 2.5 cups a day. And then there was no further benefit after that. But there was a decrease in cognitive decline from a little bit of coffee. Now for my tea drinkers, also decrease your risk. 11% decrease risk with every cup of tea. So unlike coffee, which caps at 2.5 cups, tea had a linear effect. And that was up to 11% decreased risk with every cup of tea. So all types of tea, black, white, green, decrease risk of cognitive decline. So that's kind of exciting, I think. What I want to say about vitamins, and we'll get into this a little bit more with the supplement piece, is that your baseline status matters. Supplementing, again, so kind of like with vitamin D, supplementing over and above didn't really seem to make a difference. So it was more effective in people, or was effective in people where they were actually deficient. Like we don't have a lot of folate deficiency in this country because our diet is like so many foods are fortified with folate. And then lastly, MCTs, medium chain I can't talk today. I don't know what's going on. I'm like stumbling over my words. Maybe I'm too excited. My brain is getting ahead of my mouth. Medium chain triglycerides. There's some interesting early data. And it's not quite ready for, prime time, so to speak, but it's potentially helpful. Okay, last section, because I know we're all curious. So here's what's found to be helpful. B12, especially if you're low normal, remember that 400, we want you above 400 on tests. So if you're low normal, or if your homocysteine is high, or if you're on aspirin. So aim for above 400. You might want to do deeper testing if needed. You can also add it because it's fairly safe. Omega-3s around 1 gram a day, but most of the studies were on DHA, but 1 gram a day of combined EPA and DHA. And if you're vegan, there's sources for the omega-3s. You need a lot more pills to get to that 1 gram a day, but it's doable. Gotta talk about creatine. Everybody loves to talk about creatine. What I will say for creatine is, as far as cognition, the research is emerging. It's really more for muscle. It might help cognition, but we know it helps mood. We know it helps muscle. Overall, I'm a big fan of creatine, but we can't quite outright say it's going to help your cognition at this point. But great for muscle, great for aging. The cognitive data on creatine is emerging. So we're learning more and more. So it's promising. It's promising. But I'm not ready to just say, yeah, take creatine for your cognitive health. Like those of us looking at the research are not ready to kind of guide that piece clinically yet. And then so what's maybe not helpful is, again, using vitamin D as a treatment. Vitamin D is good for you, but it's not an intervention. And we want to just optimize our vitamin D. And then when we're looking at like NAD and some of these other peptides and things, sourcing matters. We don't really have the research. Most clinicians that are really research based are not. I'm not talking about GLP-1s. We have a lot of research on that, but some of these other peptides, I'm not comfortable yet to say that they're helpful. So we can get into unknown waters with where it's sourced from and if it's going to really help. And so it might not be where you spend your money right now. Okay, takeaway. Cognitive decline is not inevitable. Yay! And here are the I'm just going to recap the 6 biggest levers that you can pull on today. Optimize your B12, lower your homocysteine, protect your sleep, protect it like a baby that's, brain is developing, right? Protect your sleep, balance your blood sugar, follow a mind-style diet, know your family history and maybe your ApoE4 status, and address menopause changes early. Address them early, not late. Don't suffer. First of all my women out there suffering in silence. I still can't believe how many people out there are just being told that there's nothing that can be done and they can't take hormones and there's nothing they can do and all these things. No, your brain is not a passive organ. It will respond to your lifestyle, to your physiology, to your hormones, to your choices. Okay, so implement what you can on your own. Work with providers that know what they're doing. Because the most encouraging part about your brain is it can adapt and it can heal. And it can stay sharp far into the second half of your life with the right support, right? So get those labs, screen sleep if it's appropriate, do a proper assessment, build a prevention plan with your team. Get an amazing team that focuses on nutrition, sleep, insulin, inflammation, all right? Let me reassure you that most of the mild, I can't talk today. Most of the midlife cognitive symptoms you're experiencing are reversible. They're reversible. All right. You have far more control over your cognitive future than you think. Your brain is adaptable, even midlife and beyond. And remember, success is a series of small wins stacked up over time. So small daily changes add up. I promise you. Better fats, better sleep, better blood sugar, better nutrients. This adds up. Okay? So find a practitioner or reach out to us if you want deeper support, more advanced tailored versions for your health. And I'm just seeing myself. I wasn't looking at myself. And so for those of you watching on YouTube, the sun has completely come and is covering the top part of my head. I guess I should have leaned in. So this will make for an interesting video, especially the clips that we put on social media. Thank you for joining me. I know my team, my podcast team is probably going to say, you need to look at yourself while you're doing your podcast. I'm trying to look at the camera and not at myself. Thank you all so much for joining me. And we are going to finish the year strong. So join me for the next 2 episodes where we're going to get into more of just finishing the year strong, looking back on the year and setting 2026 up. Let's see if I can get out of the light here. Not out of the light, but out of I'll lean over this way. 2026, or finish 2025 super strong and enter 2026 for your best year yet. Thank you so much. We'll see you next time. Thank you for joining me on this episode of UpLevel, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.